The 5 surgeries that appear safe, but I would never allow anyone in my family to undergo after age 60. It's a sobering reality that for individuals over the age of 60, the risk of falls can be as much as triple that of younger adults, a statistic often linked to declining circulation. However, there's a critical piece of information that often goes unsaid. Certain surgical procedures, frequently presented as safe and beneficial, can inflict permanent damage upon the body's innate capacity for self-healing. This isn't a temporary setback, it's a profound, lasting impairment. Alarmingly, the prevailing medical system often fails to issue these crucial warnings until it's far too late for effective intervention. I am here to expose 5 specific procedures that are routinely recommended by doctors to seniors every single day. These are interventions that insurance providers cover without question, procedures that appear minor, routine, and even life-enhancing on the surface. Yet, after over 15 years of meticulously observing patients' outcomes 6 months, 1 year, and 2 years post-operation, I can state with unwavering certainty that for anyone past their 60th birthday, the risks associated with these surgeries vastly overshadow any potential benefits. Please stay with me until the conclusion, because the number 1 surgery on this list is performed with such astonishing frequency that more than 600,000 Americans over the age of 60 undergo it annually. Disturbingly, a comprehensive study conducted in 2023 revealed that a staggering 47% of patients experienced complications that were never even disclosed during their preoperative consultations. These are complications that have, in many cases, irrevocably diminished their independence. My name is Dr. Michael Carter, and I am a physician with a specialization in senior health, boasting over 15 years of dedicated clinical experience. I have had the privilege of guiding thousands of men and women over 60 through some of the most pivotal health decisions of their lives. What I am about to share is diametrically opposed to the prevailing narrative promoted by the surgical industry, an industry that operates under immense financial pressure to keep operating rooms consistently occupied. Nevertheless, I have witnessed firsthand, patient after patient, the detrimental consequences, and I can no longer afford to remain silent. Before we delve deeper, I am curious to understand your experiences. Have you or has someone you love been advised that surgery is necessary? If you are over 60 and a doctor has recommended any surgical procedure within the past year, please type surgery in the comments section below. This will provide a valuable insight into how many individuals are currently navigating these difficult decisions. Let's explore what is occurring within your body as you age. Beyond the age of 60, your body's production of collagen, the vital protein essential for wound closure and tissue repair, diminishes by approximately 40%. Concurrently, your immune system's efficiency in combating infections decreases by around 35%. Your circulation naturally slows, meaning that oxygen and crucial nutrients are delivered to surgical sites at a significantly reduced rate. Furthermore, your blood vessels become more fragile, and bone density can decline by as much as 1% per year after the age of 50. This isn't merely about a slower healing process. When you consider the combined effects of anesthesia exposure, surgical trauma, an increased risk of infection, and a compromised healing capacity, you create a perfect storm. This storm can initiate a cascade of complications that surgeons rarely, if ever, mention during their brief 5-minute consultations. What truly fills me with dread is the medical community's standard metric for surgical success: survival of the procedure and the immediate recovery period. They do not systematically track the impact on a patient's independence 6 months down the line. They do not measure whether an individual can still ascend stairs, drive to the grocery store, or live free from chronic pain. If you are finding this information valuable, please take a moment to hit the like button. Now I will guide you through the 5 surgical procedures that I would unequivocally refuse to allow any of my family members to undergo after the age of 60. we will proceed from what I consider concerning to what is, in my professional opinion, absolutely dangerous. Commencing our discussion at number 5 is arthroscopic knee surgery for osteoarthritis. This procedure involves a surgeon introducing a minuscule camera and specialized instruments into the knee joint with the stated purpose of clearing away damaged cartilage and smoothing roughened surfaces. On the surface, it sounds like a minimally invasive and logical solution. Your knee hurts, the cartilage is damaged, so the logical step is to remove the compromised tissue, correct? However, this approach is fundamentally flawed. Osteoarthritis is not a condition caused by loose fragments of cartilage drifting within the joint. Rather, it stems from the progressive deterioration of the joint structure itself. A groundbreaking study published in 2017 in the esteemed New England Journal of Medicine followed 351 patients over the age of 45 who had undergone arthroscopic knee surgery for osteoarthritis. The findings were nothing short of astonishing. 2 years post-surgery, patients who had received the surgery reported experiencing the exact same levels of pain as those who had undergone only physical therapy. The pain levels were identical. What is particularly concerning to me is that the surgical intervention itself introduces additional trauma to an already compromised joint. It exposes the patient to the inherent risks associated with anesthesia, and it invariably leads to the formation of scar tissue. In a disturbing 22% of cases, patients reported that their knee felt worse after the surgery than it did prior to the procedure. The alternative, which I strongly advocate for, involves a combination of targeted physical therapy, an anti-inflammatory dietary approach, and specific supplements such as glucosamine and chondroitin. This regimen has demonstrated the capacity to reduce knee pain by up to an impressive 38% within a 3-month time frame, all without the need for incisions, anesthesia, or the myriad of surgical complications. There is a critical understanding that many individuals overlook. After the age of 60, your body possesses an extraordinary capacity for adaptation and compensation, but it requires the appropriate support to facilitate this process. Surgery, in many instances, interrupts this natural adaptation. It forces the body into an emergency repair mode when its optimal state would be gradual strengthening and resilience. But our journey into concerning procedures doesn't end here. It leads us to something even more troubling. Our 4th procedure to discuss is spinal fusion for lower back pain. This is a substantial surgical undertaking wherein surgeons permanently connect 2 or more vertebrae in the spine using a combination of metal rods, screws, and bone grafts. The purported goal is straightforward: to eliminate movement between painful vertebrae and, consequently, eliminate pain. I recall the case of Barbara, a 68-year-old retired teacher from Atlanta. She sought my counsel 6 months after undergoing spinal fusion surgery. Prior to the surgery, she was in tears, suffering from chronic lower back pain that significantly limited her ability to garden and made even short car rides uncomfortable. Tragically, after the surgery, she found herself unable to bend down to tie her shoes or twist to check her blind spots while driving. She was forced to sell her 2-story home because climbing the stairs had become an excruciating ordeal. Her surgeon had assured her that she would be back to her pre-operative condition within 3 months. What he failed to disclose was that fusing vertebrae inevitably transfers stress to the adjacent joints, those located above and below the fused segment. Research published in the Journal of the American Medical Association indicates that within 5 years of undergoing spinal fusion, a concerning 38% of patients develop complications in these adjacent vertebrae, often necessitating further surgical intervention. Here's the most impactful statistic. A 2019 study that compared patients over 60 experiencing chronic lower back pain found that one group underwent spinal fusion while the other group received intensive physical therapy, core strengthening exercises, and pain management techniques. After a 2-year follow-up period, both groups reported similar levels of pain. However, the physical therapy group maintained significantly better mobility, experienced absolutely zero surgical complications, and saved an average of $87,000 in medical expenses. Barbara's situation was not a unique medical miracle gone awry. It was, in retrospect, a preventable catastrophe. Following months of highly targeted rehabilitation, adhering to anti-inflammatory protocols, and utilizing nerve support supplements, she managed to regain approximately 60% of her pre-surgery mobility, but she will never fully recover her original state. The spinal fusion is a permanent alteration. These small, seemingly insignificant changes can lead to profound and lasting consequences, and you can avoid making precisely the same error. Now, allow me to share something of importance. If you are finding this information beneficial, please hit the like button and subscribe to ensure you do not miss out on the straightforward health tips we share weekly, because what I am about to reveal next is something your surgeon will likely never disclose. This brings us to surgery number 3, and this particular procedure elicits a significant emotional response from me. Surgery number 3 involves gallbladder removal for gallstones when there are no accompanying symptoms. The medical term for this procedure is cholecystectomy, and it stands as one of the most frequently performed surgeries in America, with over 600,000 such operations occurring annually. The core of the issue lies in the fact that many seniors are advised to have their gallbladders removed solely because an ultrasound or CT scan has detected the presence of gallstones, even when these stones are not causing any discomfort or symptoms whatsoever. Let me be unequivocally clear: your gallbladder serves a vital function. It acts as a reservoir for bile, which is essential for the digestion of fats and the absorption of fat-soluble vitamins, including A, D, E, and K. Removing this organ means your body loses a concentrated system for delivering this crucial digestive fluid. According to research published in Frontiers in Aging, it is estimated that up to 40% of individuals over the age of 60 will develop gallstones at some point in their lives. However, and this is the absolutely critical point, the vast majority of these stones never cause any problems. They remain dormant and asymptomatic for decades. These are medically termed silent gallstones. Studies have indicated that only approximately 20% of individuals with silent gallstones will ever experience symptoms. This means that if you undergo gallbladder removal as a preemptive measure, there is an 80% probability that you are removing a functioning organ for no medically justified reason. And what are the consequences following this removal? Research from 2021 revealed that a concerning 47% of patients who had their gallbladder surgically removed experienced chronic digestive issues afterward. These can include diarrhea, often triggered by fatty meals, bloating, and significant difficulty in absorbing essential nutrients. These are not minor inconveniences. For seniors, impaired nutrient absorption can accelerate muscle loss, contribute to a decline in bone density, and even impact cognitive function. This is precisely what I advise my patients. If you have gallstones but experience no symptoms, no pain, and no signs of inflammation, the appropriate course of action is not surgery. The optimal solution lies in dietary modifications aimed at preventing the stones from growing or causing issues. This includes increasing fiber intake, reducing saturated fat consumption, ensuring adequate hydration, and incorporating bile-supportive herbs like dandelion root and milk. Thistle. Here's a crucial insight that most individuals miss. After the age of 60, the preservation of every functioning organ should be a paramount priority. Your body operates as an intricately balanced system. Removing even one component can disrupt this delicate equilibrium and create downstream imbalances. Now, I am eager to hear from you. Have you ever been told that you require surgery for a condition that is not even causing you any symptoms? Please share your experiences in the comments section. I assure you, I read every single submission. but brace yourselves because it gets even more concerning. This brings us to surgery number 2, coronary artery bypass grafting for stable angina. This is a major open-heart surgical procedure. Your chest is opened, your heart is temporarily stopped, and you are connected to a heart-lung machine that circulates your blood. Then, blood vessels harvested from other parts of your body are used to create bypasses around blocked coronary arteries. It is an invasive, highly traumatic intervention, and for a significant number of seniors experiencing stable angina, meaning chest pain that is predictable and effectively managed with medication, it is entirely unnecessary. Let me introduce you to James, a 74-year-old retired engineer from Phoenix. He had been managing mild chest discomfort with medication for a period of 2 years. His cardiologist advised him that bypass surgery was imperative to prevent a catastrophic cardiac event. James was understandably terrified and scheduled the surgery. However, 3 days prior to his scheduled operation, he sought a second opinion. Upon reviewing his medical records, I observed that his angina was indeed stable and his ejection fraction, a key indicator of his heart's pumping efficiency, was 52%, well within the normal range of 50–70%. He remained active, engaging in a 2-mile walk every morning. I strongly advised him to cancel the surgery and instead proposed a comprehensive, evidence-based program. This included intensive cholesterol management with targeted supplementation, an anti-inflammatory diet rich in omega-3 fatty acids and antioxidants, stress reduction techniques such as meditation, and a carefully controlled exercise rehabilitation program. 6 months later, James returned for a follow-up appointment. His angina episodes had decreased by an impressive 60%, his cholesterol profile had shown dramatic improvement, and his energy levels were better than they had been in 5 years. He expressed his profound relief, stating, "Doctor, I almost allowed them to cut open my chest. I can't believe how close I came to making the biggest mistake of my life." This was not a matter of luck. It was the direct result of evidence-based medicine. A landmark study known as the Courage Trial, published in the New England Journal of Medicine, followed over 2,000 patients diagnosed with stable coronary artery disease. Half of these patients underwent bypass surgery or stenting, while the other half received optimal medical therapy. After a 5-year follow-up period, there was no discernible difference in mortality rates or the incidence of heart attacks between the two groups. Let me reiterate that for patients with stable angina, invasive procedures offered absolutely no survival benefit compared to diligent medication and lifestyle modification. However, what concerns me most profoundly about bypass surgery in senior patients is the brutal nature of the recovery. Studies indicate that a significant proportion, up to 50% of patients over the age of 70, experience substantial cognitive decline following open-heart surgery, a complication likely attributed to the duration of time spent on the heart-lung bypass machine. While some individuals recover fully, many do not regain their previous cognitive function. The underlying principle here is that you are not inherently broken. Rather, your treatment plan may be fundamentally flawed. Before we proceed to the most dangerous surgery on this list, I have a brief request to make. If you are finding the information presented thus far to be of significant value, I urge you to subscribe to this channel. My primary mission is to provide clear, straightforward, and accurate health information, empowering you to make the most informed decisions for your well-being. Secondly, and perhaps even more importantly, please share this video. Think of your parents, your grandparents, your friends. A simple click can initiate a vital conversation that could genuinely save a life. Now, we arrive at a truly critical juncture. We are now discussing surgery number 1, and this is total hip replacement for moderate arthritis pain. This is a procedure performed with staggering frequency, with over 450,000 Americans undergoing hip replacement surgery each year, the majority of whom are over the age of 60. It is often marketed as a miraculous solution for hip pain, and the testimonials of remarkable, before and after transformations can be incredibly persuasive. For some individuals facing very specific and severe circumstances, it can indeed enhance their quality of life. However, there is crucial information that is frequently omitted during those glossy, preoperative consultations. A total hip replacement is precisely what the name suggests. It is the complete replacement of your hip joint. The ball of your hip joint is surgically removed, the socket is reamed out to prepare it for the implant, a metal stem is hammered into your femur bone, and then a new metal or ceramic ball is attached. Finally, your hip socket is lined with a plastic or ceramic component. You are left with a completely artificial joint, and it is imperative to understand that this artificial joint has a finite lifespan. Research indicates that modern hip replacements typically last an average of 15 to 20 years. For an individual who undergoes this surgery at the age of 65, this implies the necessity of revision surgery around the ages of 80 or 85. Revision surgery, which involves the removal of the old implant and the installation of a new one, is considerably more complex, carries significantly higher risks, and has substantially lower success rates than the initial surgery. According to a 2022 study published in the Journal of Applied Physiology, revision hip surgery in patients over the age of 80 has a complication rate of 28%. This rate encompasses a range of serious issues, including infection, dislocation, fracture, blood clots, and even death. A 28% complication rate is alarmingly high. However, what truly concerns me is that the overwhelming majority of seniors who opt for hip replacements are experiencing moderate arthritis pain, not severe, debilitating disability. They are still capable of walking, they are still functioning, and while they may experience discomfort and some limitations in their range of motion, they have often not exhausted all conservative treatment options. I remember Patricia, a 69-year-old retired nurse from Seattle. She was an avid hiker, and hip arthritis was making her favorite trails increasingly challenging. Her orthopedic surgeon reviewed her x-rays and declared, "You need a new hip. The sooner, the better." Patricia came to me feeling conflicted. I posed a single, pivotal question. Can you still engage in the activities that matter most to you, even if they are more difficult than they were before? She paused, contemplated for a moment, and then replied, "Yes, it hurts, but yes." I advised her to postpone the surgery and instead devised a comprehensive program tailored to her needs. This included daily doses of glucosamine and chondroitin for cartilage support, curcumin for inflammation reduction, targeted hip strengthening exercises to enhance joint stability, and a shift to low-impact activities such as swimming and cycling in place of high-impact hiking. Additionally, weekly acupuncture sessions were incorporated for pain management. 3 months later, Patricia returned, her eyes filled with tears of joy. She shared, "Doctor, I'm back on the trails. It's not perfect. I move slower, but I'm there. I almost surrendered my real hip for a metal one. Thank you for giving me another option." This was not a miracle. It was her body's remarkable response to the right kind of support. And you can experience precisely the same outcomes. The scientific evidence strongly supports this approach. A study published in the Nutrients Journal found that a combination of glucosamine, chondroitin, and collagen supplementation led to an average reduction in hip pain of 43% within 12 weeks in patients diagnosed with moderate osteoarthritis. A 43% reduction is remarkable. Another study, published in the Journal of Clinical Nutrition, revealed that seniors who engaged in daily low-impact exercise and took omega-3 supplements experienced pain reduction equivalent to that achieved with non-steroidal anti-inflammatory drugs, but crucially, without the associated risks of gastrointestinal bleeding. Here is the aspect that truly ignites my frustration. Most orthopedic surgeons do not adequately present these conservative options to their patients. Their training and practice are heavily geared towards surgical intervention, and their income is often directly tied to surgical volume. I am not suggesting malicious intent on their part, but the system itself inherently incentivizes surgery over conservative management. And here is something that is rarely discussed. Hip replacement surgery permanently alters your biomechanics. The artificial joint does not possess the same range of motion as your natural joint. You will be unable to cross your legs comfortably, you may not be able to squat fully, and aggressive pivoting will be restricted. These are permanent limitations that will persist for the remainder of your life. This is not merely an inevitable consequence of aging, it is the acceptance of an irreversible intervention when reversible, conservative options have not been fully explored. Now, allow me to provide you with a clear and actionable plan for implementing this information. If you have been advised that you require any of these surgeries, here is my recommended course of action. Your starting point, without exception, must be to obtain a second opinion. Crucially, this second opinion should not come from another surgeon within the same practice, but rather from an independent physician who does not stand to benefit financially from your surgical decision. Ideally, this physician should possess expertise in both conventional and integrative medicine. When seeking this second opinion, be sure to ask these specific questions. What are the potential outcomes if I choose to do nothing for the next 6 months? What conservative treatments have I not yet explored? What are the specific risks associated with this surgery for someone my age? What percentage of your patients typically experience complications? Will this surgery primarily improve my lifespan or simply alleviate my symptoms? For your daily routine focused on joint health and pain management, I recommend the following. In the morning, take 1,500 milliliters of glucosamine sulfate, 200 milliliters of chondroitin, and 500 milliliters of curcumin combined with black pepper for enhanced absorption. In the afternoon, engage in 20 minutes of low-impact movement, such as swimming, cycling, tai chi, or gentle yoga. In the evening, take 2 grams of omega-3 fish oil and 10 grams of collagen peptides mixed in water or tea. Regarding what to avoid, please do not make these critical errors. First, do not be rushed into surgery based on fear tactics. If a doctor uses language suggesting you need this procedure immediately or risk ending up in a wheelchair, seek another opinion. Second, do not assume that pain automatically necessitates surgery. Pain is your body's communication system, not an automatic indication for surgical intervention. Third, do not bypass conservative treatments. Surgery should always be considered the absolute last resort, not the initial option. The timeline for results from conservative management is encouraging. Within 3 days, you are likely to experience reduced morning stiffness if you are consistently taking anti-inflammatory supplements. Within a week, you should notice improved sleep quality as your pain levels begin to decrease. Within 2 weeks, you will observe measurable improvements in your range of motion with consistent daily movement. Within a month, your doctor will likely be astonished by your progress during follow-up appointments. Consistency is paramount. This is not a sporadic effort, it is a daily habit. Just as you brush your teeth daily for oral hygiene, your body requires consistent support for its long-term health. You cannot expect remarkable results by taking supplements intermittently, nor can you rebuild strength by exercising only once a week. Consistency is the cornerstone of success. The power to enact positive change resides within your hands. Aging does not preclude you from becoming stronger. It simply serves as a reminder to approach your health strategically. If you firmly believe that conservative treatment deserves a genuine opportunity before resorting to surgery, please type yes in the comments. If, however, you believe surgery is invariably the answer, type 0. Your responses provide valuable validation for other viewers, demonstrating that they are not alone in questioning the conventional medical system. We have now thoroughly examined 5 surgical procedures that, on the surface, appear safe but harbor significant hidden dangers for individuals over the age of 60. This includes arthroscopic knee surgery for osteoarthritis, which has been shown not to reduce pain in the long term, spinal fusion, which often trades one problem for multiple new ones, gallbladder removal for silent stones that may never cause issues, coronary artery bypass for stable angina, which can be managed just as effectively with medication, and hip replacement for moderate arthritis, where conservative care can yield dramatic improvements. Each of these procedures has been marketed as routine, safe, and life-enhancing. However, when one examines the long-term data, when the focus shifts to what happens to independence and quality of life 6 months, 1 year, and 5 years down the line, a profoundly different picture emerges. My primary message is not intended to induce panic or to advocate for the wholesale rejection of all surgical interventions. Instead, it is about empowerment. You now possess information that the vast majority of people never receive. You understand the critical questions to ask. You are aware of the alternative treatment pathways to explore. You recognize that pain does not automatically equate to a surgical indication. My challenge to you is this: commit to giving conservative treatment a genuine 90-day trial period before agreeing to any elective surgery. Just 90 days. Diligently track your pain levels on a daily basis. Observe the subtle yet significant changes. Document your progress meticulously. You will likely be astonished by your body's inherent capacity for healing. Your independence will undoubtedly thank you for it. I reflect on Patricia finding joy on those hiking trails, on James continuing his morning walks without undergoing invasive chest surgery, and on Barbara, who learned a painful lesson too late that some medical decisions are irreversible. You hold the power to choose a different path. If you have found this video to be helpful, please do not keep this valuable information to yourself. Hit that like button. Subscribe for more practical health solutions specifically designed for adults over 60. And importantly, share this video with a friend or family member who may be facing a surgical decision. You might very well change their life. Now, I am eager to hear from you. Which surgery on this list surprised you the most? Or have you yourself undergone one of these procedures? Please share your experiences in the comments section. Your stories are invaluable. Remember, aging does not diminish your body's ability to recover. It simply underscores the importance of caring for it in the most appropriate way. And often, the most powerful and beneficial intervention is the conscious decision not to intervene surgically at all.